that brings us to your weekly capsule of health information. We call it your Healthy Dose. Now that we've rolled the calendar over another page, it says February 1st. And it is it's the month when we think about our heart and how to take care of it. And Aaron Zook joins us here with a little more information on how we can do just that. Good to see you.
Good to see you, Rich. How are you?
I'm warm. That's a
plus for today, isn't it?
That is a plus.
Wow.
Now, the heart tends to work a little harder when it is this cold if we're spending some time in the out of doors.
Yes, sir, it does. It does. And it's important for us to be active and try to exercise our heart and keep it as strong as we can. And, you know, a lot of us like to do things outdoors. You know, it's a little less monotonous than going to the Y and getting on the treadmill and just watching a TV and pounding out a couple miles. You know, you're outside, you can at least see people passing you on the road and you can enjoy the scenery, but the cold weather kind of puts a damper on that. You know, it's not quite as enjoyable to go outside when it's cold, so we got to try to adapt and do some things to make it a little more enjoyable for ourselves.
Sure. But the key is to move.
Absolutely. The key is to move, and you know, it's to move for a set period of time. It's great to run up and down the stairs a couple times at home just to get your heart pumping, but you want to do that for 10 to 15 minutes. You think of your heart like any other muscle. We have to exercise it to keep it strong. So, you know, duration is very important, and then the frequency that we do it is important as well.
Very, very true. So, with that said, if we made a New Year's resolution to exercise and to be healthy, this is a good time to make ourselves that mid-course correction, if you will.
That's right. And, you know, it's a good time to kind of reinforce some of those resolutions that we might have made. You know, January is here and gone, and it's cold, and it's not as easy to get up and go exercise as it was on January 1st when we were gung-ho about getting ourselves a little more fit. So, you know, February being American Heart Month is a good time to think about your heart and think about your cardiovascular activity to help strengthen it and make yourself stronger.
That's why this guy runs 19 miles every morning.
You know, that is pretty
exactly,
impressive.
That's it. Hey, you know, it's true that your heart is a muscle and you want to work it just like you would any other muscle and train it and strengthen it. Now, the thing that you're mentioning, though, is that you don't just want to do like a little burst here and there, but you actually want to go through some duration, some time, some mileage, and get into a routine of that.
That's right. That's right. And once you get into that routine and build up your duration, your mileage and whatnot, you want to stay there and then try to incrementally grow that as well. A good rule of thumb for exertion, if you're out for a run or whatever and you're jogging along and somebody speaks to you and you're able to speak without really laboring, you're probably not pushing yourself quite hard enough. You want to push yourself to the point where it's a little hard to talk. You don't want it to be so hard to talk that you're gasping for air. You're probably pushing way too hard, but you know, the target heart rates and things that we consider as far as how hard we push ourselves are very important to the overall health of your heart and how well you're really working your heart.
Well, and it's true, too, that if you're inside on a treadmill or something, you may very well have that heart rate and everything right there at your fingertips that you can actually monitor what you're doing and what level of exercise you're at.
Yeah, it's a good tool to use some of those heart rate monitors, and at first people think, you know, it's real cumbersome to try to use those, but after you've been exercising for a while at a certain level, you kind of get a feel for, okay, that's how hard I'm pushing myself. My heart rate's at 130 beats per minute, that's where I need to be, and before long you adapt and you sort of know, okay, I'm pushing myself hard enough or not quite hard enough, and you're able to adjust without even going to the heart rate monitor.
Yeah, I actually play a little game with when I'm on the treadmill, and that's I try to guess my heart rate, and usually I can be, you know, within a few points. I mean, a few numbers of you know, figuring accurately because I'm used to how I should feel and how I do feel while I'm exercising.
Well, you know, you're running 19 miles a day, you're going to be pretty used to it.
Right. Absolutely.
It's probably one of the hardest things to do is if somebody's not up to a routine like Greg's established or some other folks have, is just getting into that routine. That is the most difficult, I think.
It is. And, you know, there's some small tools that we can use to get ourselves into that routine. Things as simple as just keeping a log of the days that you exercise or how far you ran or how long you worked out, and then just comparing it to where you started. We're all kind of competitive in one way, shape, or form, so if we track and we kind of see our successes as we go along, it's a little motivator to get up and go. And you know, it's true too that if you have a buddy that wants to go exercise with you, you got a partner to keep you accountable, and that helps as well.
Yeah, there's power in numbers.
There are power in numbers. Peer pressure is a good thing sometimes.
Yes, it is. Well, I know that Hannibal Regional Medical Group is also kind of reaching out to the public this month. You've got a number of programs available as well as some screenings that are going to be held.
That's right. We have a lot of our providers from our cardiology team that are going out to the public and speaking at public forums, just as far as education, things that people can do to monitor their heart health. And then in conjunction with that, the medical group is offering free screenings to the public where we're going to screen for cholesterol levels, triglyceride levels, blood sugar, blood pressures, BMI, all those risk factors that roll into heart disease. We want to screen for those, talk to people about options that they have to help deter any negative effects of heart disease, and not end up in the emergency room or the ambulance with a heart attack or something like that.
Right. It's something that if you are in that position, you need to take care of right away.
Absolutely.
Don't walk around with chest pain for 3 days.
That's right. No.
Do something immediately, because it really does matter. And, whether it's stroke or something more heart-related. But at the same time, you mentioned options. We have some great options now in this area for cardiology services.
Absolutely, we do. At the medical group, we have interventional cardiology. Do a fantastic job working with the local emergency departments and EMTs, getting door-to-balloon times down. So if somebody does have an episode of a heart attack, they're able to be in the ambulance bay, go from the ambulance bay to the operating room in 15 to 20 minutes, which is phenomenal compared to national levels and things like that. So being a smaller organization, we're really able to streamline a lot of these processes, so if you do have an episode of a heart related condition, care is very accessible, very quick, going from ambulance to OR.
Well, you mentioned, Aaron, door to balloon. What do you mean by that?
Door to balloon means when a patient shows up in the ambulance bay and they're on the operating table, the interventional cardiologist has put the catheter through the patient's leg and into their heart, and then they're clearing the blockage that may be causing a heart attack.
Probably getting ready for a stent at that point.
Yes, that's right. That is correct.
Yeah, and time is of the essence, and it's best, and we've heard this before, don't think that you can drive yourself to the hospital. That's always right. Call the ambulance for medical attention. They'll know how to treat you at the scene and then transport you safely.
That's right. We're very blessed to have a sophisticated EMT system here in our region, and those folks on those ambulance rigs, they're prepared. They have all the equipment that they need to stabilize you, get you to where an interventional cardiologist can help you out.
Very good.
Then online at HannibalHealth.org, you've got a calendar of events all through the month of February. February is just loaded with all sorts of different events and activities that we can take advantage of and get some more information.
That's right. Like I said, our cardiology team is hosting a lot of heart-focused health events during this month. So I'd encourage anybody to go online, HannibalHealth.org, and look at the February calendar and see what type of events you can attend. And like I said, the medical group is hosting screenings the week of February 11th through the 15th. And you can call 573-406-5842 to schedule an appointment to attend those free screenings.
And there's also, I know this is a favorite of a lot of people that we talk to on this show segment, the Sweetheart Swing Dinner and Dance benefiting Helping Hearts Fund.
Absolutely, that's right. It's a benefit for our Hannibal Regional Hospital Foundation to work with those cardiology patients that may not be able to afford some of the medicines they might need, may need transportation to and from cardiac rehab and those type of things. So it's a great event in Hannibal, and we encourage people to attend.
All right. Again, the website is HannibalHealth.org. All right. Aaron, thank you very much.
Thanks, you guys. Appreciate it.
You going to be at the dance?
You know, I'm not much of a dancer, but I'm going to try to make an appearance.
Okay.
I'll sit in the chair and watch, but I don't know if I'm going to dance.
Social hour, right?
That's right.
Yeah, okay. All right. Thank you, Aaron.
Super Bowl pick while you're here?
I'm going for the Niners.
Okay. Yeah, I think we're all in agreement on that.
Yeah, we have to. I mean, we got some Mizzou alums there, and we have to go for that. And one more thing. Today is Tim Polly's birthday. He is the Executive Director of Hannibal Regional Medical Group. So if you know Tim, tell him happy birthday.
All right.
Very
Great.
good.
All right, Aaron, thank you. That's Aaron Zook as we talk about heart health for the month of February and take advantage of some of those special offerings there. Your Healthy Dose brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. You can go online, more information, HannibalHealth.org or HRHonline.org.